Good morning. First of all, I want to thank the authorities of the Congress for the possibility of staying here. In this presentation, I'm going to show our results and our experience in the development of virus-like particle for foot and mouth disease virus and a target vaccine from bovine diarrhea virus. The first 10 minutes is going to be related from the foot and mouth disease vaccine. So the main objective of the project is to produce virus-like particle by transient gene expression using mammalian cells in a cost-effective and scalable way for vaccine development purpose. This project was made in a collaboration between the NRC of Canada and INTA in Argentina. In Canada, the direction of was directed by Dr. Yves Durocher, and in Argentina is by my direction. Just to remember or to mention, probably you know that, but foot and mouth disease virus is responsible from the biggest economic losses in the bovine productions in the world. It's a picornavirus, it's a single strain positive RNA with icosahedral capsids, and this capsid was made by 4 structural proteins. The name of this protein is BP1, BP2, BP3, and BP4. BP1 is the protein who more immunogenic and induce neutralizing antibodies, but it's important to mention that the structural epitopes are critical for the protection. So make a VLP is a good strategy to develop a new generation of vaccines. In this slide, I'm going to show the strategy that we make. As I mentioned, we need to produce the VLPs. For that, we need to express the 4 different proteins, and to do that we need to have a plasmid have the 4 proteins plus the protease 3C that is responsible to cut in the linked pace from each of the proteins. So we clone the polyprotein plus the 3C, and we may use that from the transfections, and we produce VLPs. VLPs look outsider at the similar as a virus of foot and mouth, but have the potential to be safe. They can be used as an antigen and make a vaccine like a DIVA vaccine, the same immunogenicity that the virus, and you can produce in a biosecurity facility without problems. I must remark that if you want to produce a vaccine, conventional vaccine, you need to have a P3 facility in order to produce the infected virus. In this slide, I'm going to show our platform. The interesting of this platform is we use the same bioreactor that the conventional facilities. The use of mammalian cells, as you know, is a versatile, scalable, and well known by the industry. So in this slide, I compare both methodology, the conventional production, and the new technology developed by INTA and NRC. In the first case, the vaccine was made doing the infection of VHK cells. We produce a big amount of virus, then you need to inactivate the virus. And in the new technology, instead of use virus, you use recombinant plasmids. We can do different recombinant plasmids from different serotypes. I don't mention, but in foot and mouth exists 7 serotypes. So the potential of produce plasmid with the different serotypes is so easy. You produce the plasmid, you transfect the mammalian cells, and you obtain the VLPs. These VLPs are ever simpler, scalable, versatile, and competitive performance. In the back of the slide, I show the pipeline of our development. We initiate in 2007. Then in 2 years later, we have our first result with Argentine serotypes. 5 years later, we make our proof of concept in animals. 2 years then, we make the optimization of the system with different serotypes. And 2 years ago, we make the scaling up to 10 liters. And then we make an agreement with the company, and we are working in a big scaling up and to the registration of our development in the SENASA, who is our animal health office. This is only just to show you our scalability, our experiment of scalability. And you can see here a sucrose gradient, and you can see in all the cases we obtain the VLPs. This big one corresponds to this one, the fermentation, this one for 1 liter, this one corresponds to 200 milliliters, and these ones correspond to 15 milliliters. When we have the expression of the VLPs, then we make a size in mice. This was made last year. In this case, we use 6 animals per group, 4 different groups. We test 2 different adjuvants, and you can see in the back the ELISA titers obtained, and this is the positive control. This is an inactivated virus, and this is the VLPs. You can see the same levels when you have 2 immunizations, and the most important result is that we have total protection in the 3 cases. This is against the inactivated virus, and these are the 2 adjuvants. And just in this table, you can see the neutralizing antibodies. Commercial vaccines have more neutralizing antibodies than the VLPs, but both groups are enough to have total protection. And what happened in cows? Does it work? Well, in this case, we make an assay with 4 different groups, 4 animals per group, only 1 doses for 25 micrograms. And again, you can see we use the same adjuvants that in mice. And in this case, in the 3 different times, we have the same results of ELISA titers. There are no difference between the antibodies induced from the different adjuvants, and they are very similar to the produced from the inactivated vaccines. And when you see the neutralizing titers, they are really the same when you use inactivated virus in comparison with the 2 adjuvants. And then what happened in pigs? In pigs, we make 7 groups, 8 animals per group, 3 different doses. We test 5 micrograms, 25 micrograms, and 50 micrograms with 1 immunization or with 2 immunization. And again, compare with inactivated virus. This is inactivated virus. And you can see that in all the cases, we have a consistent immune response. Of course, when you have 2 doses, we have more antibodies. But again, when you look from the neutralizing antibodies, all the cases we have high levels of antibodies. And the important point here is that the cutoff of protection is 1.36. In all cases, with only 1 immunization or with 2 immunization in the 3 times, we have antibodies that are more than the cutoff. In conclusion, for this part of the presentation, we can say that it's possible to produce virus-like particles of foot-and-mouth virus by transient gene expression in cost-effective and scalable way. And second, that the new vaccine was able to elicit a potent response against foot-and-mouth in mice, in cattle, and pigs. Okay. So the second part of the presentation is about another vaccines. It's a vaccine related against bovine viral diarrhea virus. It's important to mention that this disease or this virus infects bovines of all ages, causing reproduction problems and altering biological products of high commercial value. And that was new for me. That is the most prevalent disease in cattle. I read that in the paper last year. This virus is a pestivirus, and the important point of that is that this protein, the E2 protein, is the protein who is involved in the induction of neutralizing antibodies. So, which is the problem of this virus? This virus produces abortion, respiratory symptoms, reproductive problems, and mucosal disease. The prevalence of this virus in the farm is 66%, and up to 36 of the animals of are infected with this virus in the world. When we talk about the losses of the cows caused by BVDV, I can tell you that 34 euros is the loss in Canada, 31 euros in UK, 48 euros in Ireland, and only 5 euros in Argentina. That is not because in Argentina is not the problem. We have the same problem of the rest of the world. The problem is that our money, the peso, is so devaluated. But the problem is the same in Argentina than other part of the world. So what was our response to this disease? When we developed a new technology, the name is APCH1. This technology is a target vaccines. The concept is that we make a fusion protein between the E2 and single chain antibody who recognize the epitopes of dendritic cells. Dendritic cells are the more important cells to direct the immune response. So the concept is we make a target vaccines in order to have a better immune response. I'm going to show you a video of how is a PCH function. Sorry, I'm going to the back. Okay, well, this is our intelligent vaccines, and here I'm going to show you what happens when you use a PCH technology. We make an assay in guinea pigs. In this case, we use 4 animal part groups. We immunize animals with one doses with 3 micrograms, 6 micrograms, 9, 30, 100 doses. And we compare these results with the immunized animals with only 1.5 micrograms per doses. This is the result of neutralizing antibodies induced by the APCH technology, and these are the results with the different amounts. So these results show that if you use our target vaccines, we improve the immune response 66 times. This development is it's important to mention that we make in a collaboration with Algenex. Algenex is a startup from Spain with José Ángel Escribano, is a partner, so we work together in the development of this kind of targeting vaccines. When we have these results, the other question was in which system we are going to produce our vaccines. We test with Algenex to produce in larva insects. We prove to produce with biogenesis in mammalian cells. We make in the INTA in alfalfa. In all the cases, we have good results, and we prove the results in animals, in guinea pigs and and in cattle, but the most successful platform in our case is with baculoviral suspension cells. So this was the platform that we used to produce VLPs vaccine. Well, when we have this result, we say, well, we need to prove and to make all the steps to have the products in the market. The first, I'm going to show all the results that we have. To approve the vaccine, we make a lot of animals, 6,000 animals from different parts of the world and different conditions. This is the first one. In this one, we prove 24 animals, 8 animals with our vaccines, 8 animals with the government vaccine, the reference vaccines, and 8 animals without vaccine. And we evaluate the immune response during 1 year. And these are the results. They are really different between the difference of immune response when you compare the reference vaccine. This is the best vaccine in Argentina, made by the government from the test of the vaccines. And this is the performance of VLPs. We can cover 1 year. This is the cutoff of protection. So realize the results of VLPs is very, very strong, and we are very happy with these results. Then we make different exercises. I'm going to show only one of this. We prove and compare 3 different farms with animals. 50 of the animals were vaccinated with VLPs and 50 with the conventional vaccines, the commercial one. And again, we evaluate the immune response during all the years. And here you can see the result. When you see the result of all the animals, it's important to mention, do you remember that I say that 66% of the farms are persistently infected with BVDV? So we have in the initial of the experiment, high titers of antibodies, and this is the level. They have 2 immunizations of the conventional commercial vaccines of VLPs, and you can see that the level of antibody when you use a commercial vaccine, they are not change a lot. And when you use VLPs, you can see that we increase the levels of antibody and maintain it in the time. And this is the cutoff of protection. But there are other groups of the animals that they are with less antibodies in the farm, probably because they are younger, or probably that they're not infected, or probably because the vaccines that they use, they are not so efficient. So the other half of the animals, the total of the animals, the other half have less than the cutoff, and they receive the 2 immunization doses as the others, and they never pass the cutoff of protection. But in the case of VLPs, they increase and maintain during all the years a high titers of antibodies. Now, it's well known that modified live vaccines from BVDV and from other diseases are better than inactivated vaccines. And for that, for me, it was very important to show these results. And that probably changed your mind about the use of inactivated vaccines and civilian vaccine when you implement the targeting vaccines. Here are the immune response of the antibodies in modified live vaccines during 4 different years in the United States in the size. You can see that this is the performance. In this case, they're half and a half. These one are with high titers, these are medium titers, and they are low titers. Animals with 2 doses of vaccine, in this case, 2 doses of vaccines, modified live vaccines. And in this case, they was immunized by VLPs. You can see there are different performance depending on the year, but in the case of VLPs, we have the best combination because we have 67% of high titers and 23% of middle titers and only 10% of low titers in our hands. So what happened now? We put in the market these vaccines 3 years ago. We have now registration in Peru and Uruguay. We are going to initiate the use of this vaccine next year. We are now registration in South Africa, and the next step is United States. In conclusion, we can say that the target antigen IPCH2 is a 66 times more immunogenic than the E2 protein alone. The target vaccine was able to elicit a potent and long-lasting immune response against BVDV. This is the last result shown that negative and low titers animals at day 0 reach similar antibody levels than high antibody titers animals. And finally, this subunit target vaccine represent a novel, safe, and efficacious BVDV vaccines. And as a conclusion of the both presentation, we can say that INTA has the facilities and know how to produce new generation effective veterinary vaccines. And of course, this work was made by a lot of researchers and this part of the group of Bioinnovo. These are the researchers of Bioinnovo. These are the other part of the group. So thank you very much for the possibility of being here. And I believe that we can discuss this presentation and the others in the next minutes. Thank you very much.